Playing reggae like you've never heard before. This is Vibes Radio.
There's something important we gotta talk. Najua tuko hapa jokes mzaha. Kevin najua mzaha ni nini?
Of course.
Si ule mse wa soka.
Mzaha ni fun, you know, humor, chiller.
So I want us to talk about something that's happening.
Oh yeah.
We've been talking about teenage pregnancies, and today we have Rebecca Nyankieya. She's a program officer at National AIDS Control Council. Let's talk about this. Rebecca.
Hi.
Good morning.
Morning. How are you guys?
Us guys are
very
fantastic.
Well.
Tulikuwa tunataka ukuje kwa studio lakini ulishindwa.
Ni kama Mombasa Road imefungwa.
Yes. It's very busy on that side.
Sana.
Rebecca, karibu sana.
Thank you.
Now, let's just get right into it. We've been, Kenya has been seeing a spike in teenage pregnancies.
Crazy spike.
Yeah, like a crazy spike. And in fact, over the weekend, nilienda huko Usaiza Machakos. I found a home of girls who had been abused by their own fathers.
What?
And impregnated.
Yeah.
We're talking, and
I saw that on the news as well.
The numbers in Machakos is very scary. We're talking thousands.
Yeah, so Rebecca, talk to us in terms of National AIDS Council. Of course, your mandate is to spread awareness on AIDS. It seems that when I was reading a report last week. They said that I think it was done by you guys that as these teenage pregnancies are happening, there's also been a spike in HIV cases.
Yeah. So obviously between when you're talking about teenage pregnancies and HIV, it's like as long as a girl is pregnant, there was unprotected sex.
Yeah.
Done.
Yeah.
So if any time that a girl is pregnant, she was probably exposed to HIV.
Yeah.
And so that obviously becomes a problem for us. And while a pregnancy will be like for 9 months, and that's done, if the boy is the one who had HIV at that point, the boy can have sex with so many other girls in that duration of time. So obviously, yes, with the increasing teenage pregnancies, there's also an increase in HIV infection because the risk is higher. Because they're already having unprotected sex. So for sure, yes, that's happening.
All right. And is this is clearly a concern for the country, but what is National AIDS Council doing about this?
Yeah, so with regards to the new infections in the country, so obviously the mandate of NAC is around advocacy and creating awareness, just like you said. And so part of our role has been to make sure that we are educating young guys, and we're not just educating them, like it's not from the government educating them, it's actually them speaking to each other. It's an approach that we are now using, which is the human-centered design or the peer-to-peer approach, which we like to call. So where we train young guys to be the ones who speak to other young guys. Because you see, the conversations they have are different, and the way they listen to each other is different. And there's always been this notion that if you're older, then you don't know what I'm going through. But when you're speaking to a peer, there's a level of understanding that you have, and there's a level of you feel that the experiences you share are the same. And so from that point, you're able to speak to each other. So that's one of our biggest priorities now, is that we want to focus on making sure that young guys are empowered enough to empower other young guys so that they're on the same level and they understand their risk, because that's a significant factor. Yeah.
But let's talk, Rebecca. Why is there such a spike? What are the contributing factors to this?
Yeah. Okay, so, the issue of teenage pregnancies has always been there in the country. So it's not that suddenly there's this huge spike. It's just that now it started becoming very important because before it didn't get the light that it deserved, Teenage pregnancies have been there. Issues around early child marriages have been there. And then so some of the contributing factors are obviously, for example, when you talk about a young girl who, when during the exam period, that period for exams, is when they're in the news, they're in the hospitals, they're giving birth, etc. And when you count back, they probably got pregnant during the holidays. Yeah. So when they're at home, they're not engaged in school. So the school has also provided a safe space for a lot of these young girls where they're, when they're in school, they don't get the numbers are not that high. But when they're at home and there's no, we don't know what is happening at home. A lot of sexual gender-based violence is happening at home. So the school has provided some sort of, safety net. But when they're home, things sort of change and they're exposed more. So there's issues around information. So obviously a lot of young guys are not well informed and they don't know. And then the second thing is issues around jobs. We talk about HIV and teenage pregnancies as though it's a health problem per se, when we need to involve other sectors. So when we talk about health for young people, it's more than just the facility or the hospital. It's really about the schools being informed. So now the schools, the curriculum reforms, young guys are being trained on sex and sexuality, which is now being called the human sexuality education. Or the life skills. So that they know the bodies are changing and what they need to expect and how to protect themselves and things like that. But obviously making sure that it's age appropriate. You can't go telling a class 3 or class 4, but making sure that as they grow older, the curriculum actually continues to inform them. So there's obviously peer pressure. That's a significant factor. A lot of young guys, the peer pressure is high. You see your friend with a new phone, or you see your friend with someone, you're like, hey, baby, I want.
Even you want,
you don't know how they got that phone. And so young guys are ending up in situations that they would not otherwise be in because of peer pressure. And also still, I think, for me personally, I think it still falls back to information and being empowered and knowing this is the right choice and this is not the right choice. And I don't think we've gotten there with young guys, and their risk perception is significantly low.
Playing reggae like you've never heard before. This is Vibes Radio.
But we got Rebecca. Welcome back on the show.
Thank you.
Of course, from the National AIDS Council. Now, before we took the break, we were talking about, I was asking this question. There's the ASRH policy of 2015, which speaks to access contraceptives for all adolescents who require the service. But how does this intersect with Children's Act that requires parental consent for healthcare?
So we obviously know, as according to the Constitution, that a child is anyone under the age of 18. So, and obviously when you're developing policies for a population that is under the age of 18, there's issues of consent from parents, and because these are children. And you'll notice that even when these discussions are being had, there's no one wants to sort of be the one who's giving contraceptives to a young girl, for example. So it's really, I think for me, it goes back to, as a society, it's not something that we have normalized. And I don't think we should normalize, because no child under the age of 18 should be getting pregnant, should be getting pregnant. But the data is telling us that if they have their first pregnancy at like 15, the chances that they have another one at 16 are significantly higher. So it's there that if you have a teen who gets pregnant, the likelihood of them getting another pregnancy is also significantly higher. But so what we're doing now is we're coming up with strategies that will actually allow us to ensure that we are preventing this pregnancy, so that we don't have to give anyone contraceptives. Because, we should not be giving a 15-year-old contraceptive. It's not okay to give a 12-year-old a contraceptive, really. These are people who are still developing, people who are still growing. And so we need to go back to what the prevention measures or prevention strategies that we should be implementing as a country. So obviously going back to our ABCs, and for children, there's no being faithful, because who are you seeing at 15? So it needs to be, we're going back to abstinence and talking about abstinence with young guys, and making sure that we're speaking to the faith sector and the churches and the religious settings, because that's where these children are most of the time with their parents, or if it's not the children, the parents are there. So we need to have conversations around abstinence, and abstinence in a way that makes sense for the young person. Because right now, I was saying earlier, risk perception is low. Kabisa, like people are like, that's a you problem, not a me problem. And so we need to start making abstinence something that is an actual solution. Because when you start talking about children, you have to think about pampers and school fees, and there's more to, like, at that age, at 15, you actually want to grow and go to school and make that a priority. So how do we prioritize abstinence for this young girl, or for even boys? For a long time we made boys the bad guys. But they're the ones, they're also children, and they're also growing.
Let me ask Rebecca, is there any data on how many youth are abstaining? Because, even as I was growing up, we were taught about the ABC. And, when you're in school, ABC really makes a lot of sense, but you find that A was abstinence, B was the one for
Being faithful.
the one for no, those two A and B we cancelled them. The C was the one because there's so much like you said, peer to peer, right? And you can imagine the peers, is it that we need? How do we intervene so that we make this abstinence cool? Because if you have you're watching what the parents are doing at home. You're watching what society is up to.
The internet.
And like you said, risk perception is low.
Yeah.
Simply because even the other day we were talking about marijuana. And we realized that to this young people, what do they call Gen Z?
Yeah.
They the risk perception is very low. They don't think marijuana is a bad thing. Same with sex. So how do we I don't know about abstinence. I'll be honest, I don't know about abstinence. But how do we get not having sex to be cool?
Yeah, you guys remember the Nimechil campaign?
Yeah.
And and for a while there, Kuchil was a good thing. But right now, the young guys, I don't know what it is. There's something about young people, this Gen Z, what we call it Gen Z, that is very carefree.
Yeah.
And it's very free spirit. So in my opinion, it has to be made a relevant conversation. You see, we're having this conversation with you guys.
Yeah.
It's becoming relevant. Like we need to make sure that HIV conversations, teen pregnancy conversations, sex conversations really are made relevant and something that guys can talk about. Because when you have relevance, then we can change behaviors and perceptions because they have to care about it.
Rebecca, what are there? Clearly, there's some parents who are getting it right.
Yes.
What can we borrow from those parents? Like, what are they? What are they doing well that other parents can emulate?
I think one is their present.
The present.
Yes, parents are present. There's parents who are very present in their children's lives, and present in the sense that they know, they're aware. This is how my child is growing. These are things I need to speak to them about at this age. And knowing that in school someone might misinform them because in school they probably won't listen to the teacher. So they are doing it from home. They're starting from home and making sure that their kids, by the time their kids are leaving their homes, they know what to expect. Because there's parents who are essentially just letting their kids go to school. The teachers will deal with it.
Exactly.
That's not something I'm going to do. And in school, the teacher is not with the policies that are there. The teacher is not supposed to talk to your child about sex.
Wow.
So then the teacher does not speak to the child about sex the way you'd want to speak to them as a parent. So you leave this child who at home no one is talking to them about it, and in school no one is talking to them about it, but then we expect that by the time they're 18 they know how to make the right decisions. So I think one is to make sure that you're present as a parent, you're there for your child, and when they ask you where they came from, you don't say supermarket or they were borrowed or those things.
Let me ask you, Rebecca. Now that information, especially for children who don't have parents, where would they access that information that parents would have their own parents would have given them?
So that's where the Ministry of Education comes in, because now with the curriculum reform, there's some leeway for them to actually speak to these young guys, give them age-appropriate information. Because, again, it's not to overload them at a young age with condoms and I don't know what options are there and contraceptives. It's age-appropriate information. So when they're not getting it at home, if they do not have, parents at home, they should be getting it within the school system as an age-appropriate information. So within the school system, that's there. But also at facility level, in the hospitals, in the healthcare centers, there's also clinics for youth-friendly services where you can actually go in as a young person and you can get this information. So there's avenues where, we are making sure that at facility level, there's someone you can speak to. At school, the curricular reforms are helping us with these issues around sex and sexuality. But also at home, we're encouraging parents to make sure that they're involved and present for their kids if these parents are there.
Is this also inclusive of street kids, for example? Because we see them with babies out there. Some of them are actually sick. What strategies do you have for the street children?
So there are some programs for these street children, because for them, sometimes they're street kids because of issues around poverty and money and things of that kind. And so some of the programs that are there are around making sure that we are providing them with opportunities that will get them off the street. So that they are now able to stand on their own. Because some of the issues that they're facing are really that they don't have any resources.
Exactly.
And they don't have a family to fall back on or someone to speak to. So the first thing is to get them off the street and then be able to give them opportunities and resources and skills that can help them be able to build themselves, but does not put them at risk for any, whether it's HIV whether it's STIs, because STIs is also a concern, and the pregnancies that are there.
Yeah. Finally, is it possible, you can imagine a child, and these are some of the cases that we're seeing out here, who have been abused at home, right?
Yes.
And especially if a child knows this is happening, what are the interventions to save that child? Because we're really putting a lot of emphasis on home and parents. How does that child approach that situation? And we see it all the time. The mom will cover the situation, or the aunties or whatever, but this child knows very well that, okay, this is I'm in a sexual relationship. What can I do to protect myself?
Yeah. So number one, if the parent is not a person that they can approach, or if the parent is the person who's the perpetrator in this case, they need to be able to get to tell them, like, make sure you go to a safe place, whether it's school. You see now, like as I said earlier, I think in the beginning, that schools have provided such a beautiful safety net for a lot of these young people who are getting abused at home, because when they're in school, no one is abusing them. Yeah. So at school, the school provides a safe place for these young guys. If the perpetrator is at home, school is the next step if they're going to school. And if they're not, a facility is the next step. Make sure you go to a facility and find someone. And if that's not possible, there is a helpline, and I think I'll be able to share it with you for young guys who are, for people to call in for issues around gender-based violence at home for children. And it's the Child Protective Services that are supporting the line. And so there's a contact that you can call and say, this and this is happening to me, and I don't think it should be happening to me.
Okay.
So number one is to make sure you find a safe place and someone that you can speak to without feeling, scared or concerned, because sometimes the problem is at home.
Yeah.
So it's when you go to school, make sure you find a teacher that you can speak to, because the teachers are now trained to know, okay, this is what is happening, these are the next steps to take from here.
Yeah.
To make sure this child is safe. Yeah.
And I know I said that was the last one, but this is completely the last one, Rebecca.
It's okay, no problem.
I encountered a situation where something like that happened to a child, and went to the school and found that I found a gap which is the way the teachers were approaching the situation, even making it seem, they were asking the girl because she had been raped and on her way to school. And they grilled her for like 2 hours, asking her to tell the truth. So is there anything that national AIDS can, because this is the reality. Is there anything that you're doing to be able to train the maybe one personnel in each school, on how to handle such a matter?
Yeah, so we do have programs with schools and teachers on sensitizing them and training them on issues around HIV and sexual gender-based violence. So those are programs that are there. We even had recently concluded training for the TVET, the TVET schools, vocational training. Yeah, training them on, like, just to sensitize them on how to handle such matters. Because just like as you were talking, I kept thinking back, if I was abused, was the teacher someone? Because I'd feel like, tell the truth, tell the truth. It's almost like I'm lying, or I put myself in a situation that now it's my fault. They're victimizing them again. So I think, yes, so there are programs that we're having for sensitizing teachers and make sure that there's that teacher, they're calling them, the guidance and counseling teachers in schools. So we're empowering them with these skills and information on how to handle such a case when it's happening within the school or at home, or a student who's going through that. So yes, we have programs like that. And the idea is to make sure that we saturate the entire education system, and that they are, at least in every institution, there's someone that you can speak to that has this information and is able to support the young person that's going through that.
All right.
Yeah.
Positive vibrations on the morning vibes.